This is Pat Cook with the Colorado Gerontological Society. Maria is also on helping me out. And we are going to do part one of updating your quality management program. This is one of 3 or 4 series that we will talk about quality management and get everybody back into their comfort zone. We started to do this last year, and then COVID hit. So in the beginning of the month, I'm going to be talking about COVID and some of the things you need to do to keep that cleaned up. One thing, please do not change anything you're doing. We are not out of masks. We're not out of goggles. We're not out of signing in. We're not out of testing. Everything's status quo. There is a meeting next Wednesday, and we might get some update because we have done a fairly good job of vaccinating all of the residents in all the assisted livings where we're lagging behind as staff. But this program today is totally to discuss what is going on and how to get your quality management program back up. Okay. So this is a renewed opportunity, and what's good about it is that we have an opportunity not only to look back a year, see how we grew, which we grew as an industry like crazy people. And we can also identify issues and lag points in areas that are difficult. And we want to remove as many threats to your business as possible and have a very status quo and day-to-day routine that's very stable and predictable. And that predictable part is one of your goals of having a good quality management plan. Some of you may have plans. Some of you may have plans written by other people. Some of you may not have anything. It doesn't matter where you are. You need to start somewhere. And so for some of you will have more work to do than others, and that's okay as well. So the biggest threat is I want to make sure that you have either something in your possession that can be fine-tuned, or you're starting from scratch and you build a plan from the ground up. It's perfectly okay. So quality, the real concept of quality is taking any issue and figuring it out, figure out what works, and then make it sustainable by being able to do it over and over and over. I think of all my years that I have been practicing and all of the things that I have done in my career. This last year has tested me in quality more than any other thing that I've been involved in. And so I look at it as this was a car that my father-in-law owned, and he had great pride in it. And so getting the parts and keeping it running was important to him. And we spent a lot of time over 40 years keeping that thing going until one of his nephews actually took the car over and uses it in his outreach in the community. Me personally, I prefer a new car that actually functions. I don't want to have to do anything more than to put gas in and get the tire rotations and do the quarterly upkeep. So it's one of the things that is important to me is having something that I can depend on. And this is what a quality plan does for your business. It's dependable. You know all the parts. You fine tune the parts that are weak, and you keep the parts that are strong going steady state. And so that you know exactly where you are at all times. And so quality takes some time. If you haven't started, you're going to be putting some pretty good time into it. If it is in reasonably good shape, you may only need to put a couple hours a month into it. It'll just, every one of you will be different. I don't want you to be scared about it. So let's check in on some things that are really important. I want you to, please just grab a piece of paper, write down one thing that you learned last year that you had no idea you needed to know. And then I'd like you to write on number 2, one lesson that you learned that really came back at you and slapped you across the face and said, wake up, you got to do this a whole lot better. From those 2 things, you really should be able to start thinking about and looking at what we call resiliency. In other words, even in our state, through the whole thing with COVID, We started off rocky as could be. March and April last year, we couldn't keep anything for more than an hour or two, and they were changing it. We're still in that mode on the vaccination process. And we have a lot of factors coming in. Who's going to be vaccinated? How much can they actually make? If they're making it too fast, does it have a quality? Is it going to be as good a product as it should be? Is the virus smarter than us? And is it going to change up so that it can get around the vaccines? All those questions will continue in our lives this whole coming year. And that's why I'm separating COVID from this, because I will be talking about COVID once a month, at least for the next 2 or 3 months, why we continue to stabilize that. And then the other thing I want you to think about is, what did it take your staff to be able to be successful? And what did they need? And then if you had a lot of turnover, you probably were missing some marks about staff success. If you had really low turnover, you probably did some things and didn't even recognize it, that you did some things that will be very useful in the future. Majority of all of the agencies and a lot of administrators that I have had the conversations with in the last 2 to 3 months are all over the board, and it's okay. But one of the common themes is that we want to do a better job with our staff and to help them grow and feel more comfortable in their roles, because we need them. They're an important piece of keeping this industry together. So we're going to look at a model that is used widely in Colorado, and it comes from a program called Six Sigma. So when you're first learning quality metrics, this is where you start. And then as you get stronger and stronger, you start earning belts like you do in karate. And you can get all the way up to a green belt or a black belt. And as you get more and more comfortable doing quality, and you actually produce quality, and you can document quality and make change. In Colorado, we're not even quite at a green belt at the moment in our industry. Or in COVID. We are still actually really, truly working out a tons of cycles and pathways and best practices and things that will work over and over and over. One of the things that fell down was the curative situation, where it worked for a few people, didn't work for other people at all, had various successes in the middle, to the point that the state pulled the contract, and then they went on shopping and they found Mako. So far, what I'm hearing about Mako's actually coming out pretty decent. So maybe they will be our success. Hopefully, we will be out of the massive testing in the next 90 days, and we will only test when we have an outbreak, either with staff or residents, and we'll have to figure out some detail in the middle. So this is a good example of plan. What is the issue? How do we keep our residents safe? How do we keep the virus out of our facilities? How do we keep the death rate at 0? Natural death is one thing, but COVID death is another thing. What are some of our best practices? What are things that actually worked? And then what action steps did we take to keep them steady state? So we went from A to B to C to D consistently, and you don't change processes when they work. The people that get bored with the process and they want to do something different usually make a mess of it, and they should put that creative energy into something that's useful instead of messing around with good practices. And that's one of my frustrations with the vaccine program, is that we gave them a lot of feedback before the vaccines were even available, and they chose to go a different pathway. Now they're backing up, and they're coming back to the top 5 recommendations that was given to them in the first place. So we wasted a lot of money as a state in software development and call center development and building processes and building scripts and all that, where we could have kept it pretty darn simple and been able to actually use data that we already had in the state, and only had to expand for a part of the population, not the full population. So I like plan, do, act, study on a lot of things. But I tend to migrate up because I've had the privilege of working in quality for some time. But when I work with facilities, this is where we start. We look at each area in quality from these areas to see what was your plan, why didn't it work, what regulations got in the way, or what statutes, or what feedback loops you got in the way, and then what action steps you have to take to make it better and make everybody satisfied. And then again, this is successful and for all parties. So one of the things that you get a big laugh out of this, but it's very common in quality to ask why about everything. And so when you work in a group and you get a lot of whys, you're actually getting a good thing. And so when we've had our quality meetings here in our office, we have a parking lot and we put a lot of whys on that parking lot. And then we may build in certain sectors, we may build out something, and then we have to go and fine tune it and clean it up until we've got a really good product that works time after time after time after time. When you're working with people, sometimes that can go awry, not because you did anything different, but because the world or your society or your county or your city or our state changes things. So don't be afraid of whys. I kind of look at whys a lot with 2-year-olds and 3-year-olds. And I know when my kids were little, I didn't have a lot of patience for whys. When I start getting grandkids, and as I got older, and then I got the great grandkids, and now the whys are coming again, I have a lot more patience to actually listen to them because they actually ask some pretty good posing questions. So your residents are going to be your feedback loop on why. And they're going to ask, why do we have to stay in our rooms? Why can't we go with our families? Why do we have to wear a mask when we go out the door? Why can't I sit with my friends? Why can't we do this? Why can't we do that? That's actually your audience of why. So one of the things I'm going to ask you to do between now and the next time that we meet is please make sure you've had a resident meeting. I would encourage you to do it in pods or small groups and talk to them openly about where things are and kind of the vision of where we're trying to go, and try to get all of their whys. Have somebody else scribe for you, because if you're taking notes, you won't listen. And so have somebody scribe and just write it all down. Don't worry about whether it makes a lot of sense unless you know how to do a workbox. And if you know how to do the workbox, then it'll make it a little easier. You put topics and then you put the concerns, and then when you work later in the group, you can put actionable steps. But one of the things I really want you to do is to sit with the residents, sit in small pods, sit with your staff, and find out what's important to them, what their questions are. I was listening to a seminar a couple of days ago, and one of the administrators brought in a doc to talk to all the staff about the safety of the vaccines and the safety to their family, the safety of pregnancy, the safety of future pregnancies, all of these things that were concerning to them, and answered them very truthfully and very honestly. And they went from a small percentage of staff being vaccinated to, I think, almost everybody. And so again, a lot of times when we understand what why means, then we can start actually repairing the whys and getting some actionable work. The second part that goes with why is the who and what. So the first question I always try to ask myself is, why in the world is this going on, and how did I get into this situation? What's the issue? Did I cause it? Did I misunderstand? Did I miscommunicate? Did I not have enough clarity? Did I not put it in writing because it went in one ear and out the other? And I work with a lot of families and seniors. And over the years, I've changed a lot of how I tackle this on the phone. And I make them write down things and put it into some sort of sequence of order. Because a lot of times when you're talking to people on the phone, they really aren't paying attention to you. Same thing that happens in your staff meetings when people are playing on their telephones or doing Snapchat or whatever in the world they're into these days. Or if the TV's on and the residents are watching the TV and are not paying attention to you in a resident meeting. I've been in those kind of meetings. So I want you to look at the big picture and how do you capture attention and find out what some of the real issues are. Is it on the moment complaint or is it a recurring situation? The ones that we're worried about in quality on the big aggregate is that we're worried about the recurring situations. So I'm going to bring you back to something that's going on in Texas right now. So Texas is an independent electric grid. They have 4 or 5 models in the state of how they build gas and electric in their for the state of Texas, and they were introducing windmill and some other more progressive energy units. And so when it went down, the finger pointing was at the new. In reality, it's at the old. And so the windmills were working fine. Natural gas is having some problems with freezing, and they need to figure that out because they're not used to being that cold. And so they're going to have to mitigate that, and that's going to be one of their big hills to climb. But they have to also look at their other their other avenues of electricity and heat and for their communities and how that's going to work. One of the positives for them is they did have a plethora of large generators and kind of great big trucks, and they were able to take generators to hospitals and to big nursing homes and those kinds of things. So sometimes we think we know what the issue is, but we have to take the time to dive into it. And sometimes Eileen and I spend a period of time. We have an issue, but we're diving into it, trying to understand when did it change or how did it change. And then the question I always ask is, how did we miss that information? That's probably one of my whys, okay? And then you want to know what regulatory agencies are involved in our industry. It's not just the health department. So we have new stuff coming from OSHA requests to facilities. We have labor board. We have unemployment. We have workman's comp. We have liability insurance. We have HOAs. So we have a lot of people that influence our business units, and we have to understand them for each of our businesses, and you have to understand your community and the people that have a finger in your pie, so to speak. And that's part of that prevention. When you understand all those players and you have a really clear picture of what they do and don't do in your life, then you are tampering down or mitigating your risk because you have a pretty good work plan for their area. And one of the old ones that you're used to is fire and safety. So you all learned how to deal with your fire alarms. You all learned to deal with your exit signs. You learned how to deal with your sprinklers. And then what happened is we had a roof catch on fire in a community a few years back. And because they had put a sensor up there, but the sensor shorted out and caught on fire and caught the roof on fire. So again, unperceived, we didn't, wasn't able to predict it, and it caused great big harm, but then it created more discussion and we did more mitigation. So one of the cool things with COVID, it's taught us to understand the concept of mitigation better than anything I've ever been involved in my life. So let's talk about some of our early success. First of all, because you're here today, you are taking care of you, and that is your own well-being, and you need to be very happy that you are willing to cross over this pathway and join this. We are working better on communication, so communication comes in multiple ways. This is one form of communication. There's written communication. There is social media communication, which is really challenging. 90% of it, you can't take at face value. There is resident communication. There is family communication. There's emails. Communication is probably one of the largest tools that we have to deal with, and one of the hardest tools that we have to deal with it. The third thing, you're here, you're interested, you're willing to work on it, you're willing to look at all your communication tools, and then together as a team and as an industry, we want to work on resolve and building strength in our industry. It's really important. We have a lot of opportunity right now, and together we can make this opportunity shine or we can kill it. So one of the tools that I want you to get familiar with, because my goal is to help you use this tool. It's been around forever and a day. It's called a SWOT tool. So a SWOT tool is a mechanism of gathering information. When I said your workbox, this is part of a workbox tool. So when you're looking at different things, like if you look at your kitchen, or you look at your laundry room, or you look at your fencing, or you look at your parking lot, or you're looking at your training, or you're looking at onboarding new residents, or you're looking at marketing. I mean, just think of all those little pieces of the pie, and they all have to fit together. Out of those pieces of the pie, you always want to look at your strengths. What do we do really well? So we've upgraded, if you upgraded your website, that's a strength. If you have new video that you can do to market and show your community off, that's a strength. If you have updated your policies and you've reviewed them for this year, that's a strength. If you have your training, you've got it mapped out and you know that let's say you're a memory care community. So not only do you have the standard yearly training that you're obligated to do, like HIPAA, first aid, CPR, emergency for planning, mitigating anger or diffusing, using heat, that type of stuff. You have additional 8 hours that you have to do if you're a memory care community that's required. And there's topics in that are recommended. So it could be a strength, or you could be totally not there, and that would be considered a weakness. From the things you identify, I always want you to think that everything that you've identified always has an opportunity. One of the other really good wins from this whole issue of COVID is I've never seen as much good, reliable, vetted, scientific-based information out there ever in my whole career as we have right now. So pretty much I can avoid all the noise, and I can go to the people with a voice that have studied it, whether they're a university, a medical center, a freestanding agency, a consultation agency, whatever, and we're getting some really good product out there. So our opportunity right now is better than it's ever been. But we also have a few threats. We've talked about a couple of those. So threats include things like social media. So if you have a bad bunch of posts on your agency or your facility, then you got to go work with the company to go get rid of those and to mitigate those. And you've got to fill that up with positive feedback and stars. And now this new thing where they're dropping stars into you and helps pay for your web costs. And it's a whole new thing that I've seen going on for the last month or so. So for every weakness, we can look at the opportunities, and then we will identify if there's any single threat that could really get in your way and keep you from being successful. A lot of times I find in my work that people dismiss their strengths. So this is the next thing I'd like you to do, and I'll give you a couple of minutes. Quickly, one word in for each of these, 3 of your own strengths, your staff collectively, their 3 strengths, and 3 strengths of your residents. So while you're doing that, I'll talk about some of the things I've been seeing in the last few months that I thought were incredibly cool. So I have seen what a whole house early on last year went down with COVID in just like a week. And every one of the residents and every one of the staff was sick. They made a resolution collectively that they were going to get healthy and get through the COVID together and not have anybody die or anybody go to the hospital. And they did just that. I saw another facility, had 2 or 3 people come down with COVID and 1 or 2 staff members. And they were able to isolate them and quarantine a couple other staff that needed to quarantine outside the facility. They were able to get through the long hours and lack of staff. They were able to get some food and stuff brought into them. They were able to keep the healthier residents active in their rooms, and they were using laptops and tablets to talk to families. And so by instinct, because they really didn't have a plan, they kept that house together and they got through it. And they were exhausted, but they got through it and they were able to learn from that. On staff, the facilities that are doing really well with staff is mostly because the staff trust the management team and there's a buy-in together and there's a resolve together, we can do this. Some of the staff in the early part of COVID were so scared and they had so much misinformation that they left the industry, but I'm starting to see them trickle back in. I think one of the other strengths that we have been able to pull in a little bit, I'd like to do more of it, the hotel industry is not coming back as fast as they'd like. And there is some incredibly well-trained people in the hotel industry, especially housekeeping. They've been training mitigation techniques forever. And they do a great job on zone cleaning, and they know how to do head to toe, and they know how to do all that. We've had a few chefs from the hotel industry come into our industry, and they're producing food, and the residents are so excited because they're getting some really wonderful food and wonderful menus that they didn't have before. And again, because chefs are foodies, they're more willing to do that kind of work versus when you're trying to do everything else and you're just trying to get some food on the table. I think in residents, I thought we would lose a lot of residents out to the community. We did not in the small homes as much as I was anticipating. And most families, I'm not going to say all of them because we've had some family problems, but most families were willing to work with us as we walk through this, as long as we kept talking to them. And so one of the other strengths that I saw early on was really good communication. I've seen that taper off, and it needs to come back. We need to continue to have a lot of communication because, again, this stuff's not over. All right, so some of the threats that came into our industry was money just didn't stretch far enough, and it was costing more for staff, and we had to pay overtime, and then we had a wage increase in Denver, and then we had a wages increase in other parts of the state, and so it was hard to adjust and make all that work. Supplies went off the roof. I know it was costing a lot just to buy groceries for myself, and my daughter was spending twice what she normally was spending. We had other people that were hoarding supplies, and that drove paper goods up, and now they're trying to sell it. So supply costs was a threat. Time. There was never enough time. I mean, all of us, everybody I know in this industry, everybody I know in the agencies, in the communities, all the government employees, all the governor's employees. I mean, I can't think of anybody that didn't work a lot of hours throughout all last year. And actually, a lot of the people I work with now are still working a lot of hours trying to mitigate issues with our senior populations. Endurance was a threat. People got tired, people got sick. Had a few people that literally ended up on disability. We had a few long timers, as we call them. They got COVID really bad, and they never was able to return back to work. And then regulations and corporation feedback and statute changes, the public health orders, the governor's orders, all of that got really daunting for quite a while because they sometimes conflicted, they didn't make sense. They were written for nursing homes and then shoved down into our industry, and they didn't really understand our industry. I think they do a little bit better, but we just had all of that. So those were a lot of the different kinds of threats that we were experiencing. Our weaknesses throughout this last year and even prior to that, we had a lot of knowledge deficits. We have a lot of different skill sets in our industry. We are slowly starting to build the administrator role to be more static and stable and more consistent, but it's not easy. But we got work to do, but it is one of our weaknesses. Experience goes, again, even some of the most seasoned administrators didn't have the experience they needed to get through COVID or the faith in themselves, and they needed a lot of support. We had doctors and practitioners and nurse practitioners that were very all over the board on how to practice with COVID. They had to learn telehealth. They had to learn how to ask the right questions to get the answers that were important so that they could guide people. They had to figure out how to deal with pharmacies, and then they had to feel how to deal with insurance companies, all of that. So medical confidence was a fairly sizable weakness throughout the last year, and continues this year. We're still not back to a steady state in medical care across the board. And then our action plans got really wobbly, but this is one of the places we're going to work on and have a lot better plans. So what did we do better than what we expected? Well, the feds started off kind of giving information, but recently in the last 2 months, I'm seeing the directives be a lot more concrete, followable, and that I understand them, what they're saying, and what they want out of us. State communication process is improving. We're having those, we have meetings that Eileen goes to that are multidisciplinary. We have the infection control meetings. We've had some ALR meetings. So it's starting to improve. We've got websites that are actually decent. So COVID-19 helps me a lot. For Colorado, the data processes are helping. That's good. I think leadership from the governor's office, I said from the get-go, they surprised me. I thought they did really well considering that they had little to build off of and they had a lot of work to do, and they spent a lot of time getting there. The infection control team down at the health department was phenomenal. How they pulled off the COVID testing, how they pulled off the testing, the variant testing, how they've been able to pivot to get supplies in, to get even those stupid barcode readers that was sent out that were broken and dirty and filthy, and we just put them back in a bag and we're going to send them right back to them. All those things, they had to do a lot of pivoting. We had some local governments really get into it. So like in Summit County and Route, it was fun to watch them because they just jumped in both feet, and they were doing things long ahead of everybody else and got things done. Same thing up in Steamboat. They got a lot of things done. And then I think it was either Aspen or Dale when they built the chateaus for dining. And so I've been looking at those as one of our ways that we're actually going to be able to do in-house visits is to have some sort of chateau situation. But so I've been watching the local governments and work at their work. And then in some of the rural areas, some of the health departments have just got hand in hand. They went out and they educated. They weren't punitive. They were teaching. They helped the staff understand. They helped the management company understand. They talked to residents. They talked to families. They talked to the community. They got information out in their community websites, into their papers. So a lot of the small county health departments were incredibly strong. Things that were not quite as successful, even though we had a lot of good communication, we also had a lot of not so good communication. We had a lot of challenges with supply chains. So I remember early on, Eileen and I both spent an afternoon calling around and working through, and we were able to find a company that actually went out in their pickup on a Saturday and delivered to some assisted livings that were out of toilet paper and paper towel and cleaning supplies. And they took it on themselves and went and did that. It was really cool. We had problems with getting applications and paperwork through systems. That was driving me pretty nuts. We had a lot of challenge of care coordination, especially with home health and hospice and on-site supports, dental, foot care, all of that, because we kind of just stopped and shut everybody out because that's what we knew that we needed to do right then. But then we had a heck of a time coordinating and getting that back in gear. And we're still working on that. We had to, if you guys remember right, the first time that the state sent out this incredibly long tool, you would have to have a PhD in nursing or public health to fill it out. And we raised enough cane as an industry that we got a isolation plan that was doable. It was still hard, but it was doable. And then we got EM resource. and then we've gotten other tools, and we still need to do a little work in our isolation plans. But the action plan, the original action plan was a train wreck. And last but not least, I don't think any of us got enough rest in the beginning. So hopefully we will have better of a life-work balance, and I'm trying myself to do a better job of that. So I don't want you to dwell on criticism, it won't help you. We really want to grow. And so the things that I want you to grow is I gave you a couple of assignments just to get your brain thinking this way. But I want to work on 3 areas for your quality plan for 21-22. And as I said, the next couple of meetings, I'll be talking about some of the stuff that you need to make sure you have in it. But this is a priority work plan to get you started. So one of the assignments is we've had a bunch of human resource law changes. They're all pretty well spelled out in different areas, but you guys need to review them. When you do an administrative update, I would like you to do something new that you probably have never taken the time to do. I want you to start a tickler list or a tracking sheet. So when you go and work on an area and you review work that's done under Department of Labor or Denver, authorization of this new wage law, or you go to unemployment, or you go to workman's comp, whatever you're doing, write down the website and what you studied and the date. And then if you would please, put the amount of time. Did you spend 30 minutes on it? Did you spend an hour on it? Did you come back to it 3 or 4 times? Did you take things out? Whatever you did, just a little note. If not, it doesn't have to be super formal. Because one of the things in our industry is the administrators have never taken credit for their training. The second one that needs to be done in the next month is I just want you to find your emergency preparedness plan. And we're going to have to revise that whole thing because we've learned so much. And so we have an isolation plan that's for pandemics. But in the emergency preparedness plan, I want you to think Texas today. So if we had an outage, we had one last year, I think for my house, it was over 4 days. Do you have a generator? Is it been tested? Can you get it on? Do you know where you would plug it in? How would your house run? Do you have people on oxygen? Do they have a backup battery? How would you manage that? Do you have an alternative site you could go if you can't stay at your house, if you had a fire or you had a water break? And can your staff react to it? And can your staff not, I'll tell her later, and you lost 3 or 4 hours, and keep you in the know. So this is the beginning of looking at emergency preparedness. And I just want you to find your plan and ask yourself these questions and make a little bit of notes on your plan. Do you have the right plan in place? And if not, no problem. We'll work on it. And and share some good practices, because what we thought would work as an emergency preparedness plan in 17, 18, and 19, I have now decided that will not work for us. We're going to have to do some additional thinking about how we're going to get through natural disasters, fires, floods, lack of electricity, supply deficits, lack of staffing. So, we had a little bit of a gap fill where the state found some people to try to help. That's gone. And so if we have a staffing deficit, how are we going to get through that? And how do you have the money to get through it? And so emergency preparedness is going to look, I think, different than what we've tackled for the last few years. All right, so celebrate success. And that could be things such as time management, any improvements you've made. I know some facilities I've talked to, they've actually been able to do some indoor and outdoor work, make things better, put in spaces for gardens this spring. Having a little bit of time to do a little bit of those things are all good. Maybe you got some new relationships of where you buy supplies or how you buy supplies. You don't depend on one avenue to get all your needs met. Maybe you've met some new friends. One of my goals with the administrative circle is I want people to get to know each other. And part of my goal before summer is to have an open forum and actually introduce people together using Zoom, because you don't have to worry about not filling your place up. I can tell you the calls we're getting in our office, we've got so many people we need to place. It's going to be very, very busy for the next few months because they're starting to show up and they're very frail and they're very depressed. And some of them have new dementia. Some of them have lost family members. A lot of things are coming. I'm not too worried about filling up the industry in the next few months. I also want you to celebrate your own coping. What kept you together is going to be very different than what kept me together, what kept Eileen together, what kept Maria together, or Bernie. And then we've actually met a lot of new people, and that's been super exciting to me. And every time I meet new people, I get new ideas or new thoughts. And so I'm very, very happy about this growth that we've been through. So remember, please print your QMP that you have. If you don't have it, don't panic. Red circle anything if your current one. If you don't think it's working anymore, just circle it in red or identify it in red. Yellow anything you want to take forward. And that's all you need to do for the time being. I just want you to plant some seeds in your brain, okay? So today we've been working on what we call element 1, and it is totally assessment. So when we work on elements in the assessment world, generally the 5 or 6 areas that we have to pay attention to are these, and we call them parts or building blocks. And so when you're studying early quality, you build foundations. So remember that plan, act, see, do, where the plan is coming, but right now we are studying what we have and identifying through SWOT where we want to get our own agencies to act. And it'll look totally different. Every agency will have a different focus and a different viewpoint. I'm hoping that we will get more collective voice and collective viewpoints for our industry over the next year. So you're going to look at your business models. Make sure your licensure is current. Make sure your insurance is paid. Make sure your workman's comp and employment is all cut up. That you've got a written budget. If you need a CPA to do that, we've got a couple of CPAs that we know that specialize in our industry that are quite good and have the tools if this is something that you're not comfortable with, if you need that help. Plant management. I call it front door to back door. So in other words, what I teach administrators when I was going out in the community a lot is when you walk in your front door, put your purse away, lock your office back up and make a walkthrough and look at your whole building. And if there's something little that needs fixed, just fix it. Don't fuss. And if you need to talk to some staff members and do a little bit of coaching and loving on them, or just mid-rushing, in other words, just having a conversation, do it. But take some time every day to go from front door to back door. Look outside. Is everything good? Did the fence fall down? Did a squirrel eat your internet line? Is there trash where it shouldn't be? Take care of those things daily. Every day that you're there, take that time, just get that out of the way. Because you need time every day to work on other things. Resident services is going to be a topic that I will run through this quarter. Well, probably not this quarter, sometime before the end of May, because resident services has got to be cleaned up on industry level. We have a lot of missing parts, and when you get a survey, if those parts aren't in place, I'm seeing tags come for that, and then you got to go and you got to go find it, and that's a lot of work to go find it and redo. It's easier to do it from the get-go. We got to establish a whole new marketing plan. So how we are going to have conversations with case managers at hospitals, at rehab centers, community case managers, community agencies, families, and convince them that we are a good place to be and that the care that their loved ones getting is top notch and it's going to make a difference in their lives. We've got work to do in marketing, but we can do it. Industry engagement is attending this kind of things, going to the infection control meetings, going to the ALR meetings, going to industry meetings like CALA, that's being rebuilt and expanded and hopefully will be a good voice for the industry. You got to find time for those things. You can't put your head in the sand anymore and keep this business open. And then regulatory. So Eileen, and then I get in on it all the time, but we're working on some regulatory management, and Eileen will be talking about those things in the near future, and what for small houses, what's a commercial kitchen, what does it look like, how are we going to keep the social model. I am stuck on a rock that I do not want to move this to a medical model, and I want to keep it as a social model. Not everybody needs skilled care, but everybody needs help to thrive. So we got invited yesterday. It was kind of cool. I was pretty surprised. We got invited to join a conversation called Health Equity for Communities, and it's going to be a statewide initiative. And that I'm hoping that door will bring in a whole bunch of stuff that's all over the place, get it all cataloged under one roof and redefined, reprioritized. And then hopefully somebody in our agency will sit at that table. And part of that voice will be our industry, which I call our industry because this is the one that I like to work in. And so that we are a voice for health equity for all of our residents, that their needs are met on a social level, and that they are safe and they're happy and they're engaged and they have purpose on a social level. And medicine is just a piece of their life and not all of their life, which is what worries me with what's going on the national scene. All right, so big thing is that we have to modernize, and people that know me quite well know I use the term a lot. So we're going to come out of the early 70 and 80 model. We're going to modernize to 2021, 22. We're going to use all the tools we can get our hands on that are affordable, all the knowledge we can get our hands on, and good best practices, and be able to fine tune when we need to, but have a stable package. That's what your quality plan will do for you. So please remember that if you're not a member of CGS, make sure that you have renewed for this year or join. It's on our website. Your memberships and everybody sewing into this is how Eileen is willing to let me continue to do these. We also have a fee-for-service opportunities that we can offer and help facilities more hand-on-hand get to where they need to go. But these programs will come from membership. So next session, we will look at opportunities and ideas. We're going to work from element 2 through 5 and looking at the core of the process and continue to build out the metrics in those areas that I've identified that are important. If you need to talk to me, feel free to call, contact me, whatever you need. And there's no stupid questions. It'll be very vigorous that we actually can get the time to do this before we have another pandemic or another craziness get in the way, and then we get back on a shelf, which is what I'm trying to avoid. So Maria, are you able to open up the mute so anybody can talk that wants to?
Yeah, so if anyone wants to talk, either raise your hand or let me know in the chat, and I could go in and allow you to speak if you want to.
So I'm glad to take 2 or 3 questions if anybody has any.
We do have a question in the chat. And it reads, can you explain more about dropping stars and web costs?
Yeah, it's a new process. I belong to two national associations in my art crafts. And so there's this new thing. So a lot of small businesses are doing video trainings, and if you belong to the association, then you get so many hours that you can go see videos on that crap. Well, when you're in these trainings, if you like them, you can go into this thing called stars, and you buy these stars, and then you can put 1 to 10 stars in, and that person that's giving the training gets revenue. So it's a new social media thing that I've been seeing for about the last 3 weeks. But in my art world, it's growing rapidly as a avenue of saying things. So whether you buy product from people or whether you thank them for being there and training and giving you new knowledge or renewing your knowledge, it seems to be this new part. On our in general social media, you can go in and people can give accolades on your website or in social, Facebook, Instagram, Snapchat, whatever you use and you get out there. Where we get in trouble is when people get mad at you and then go put in nonsense. We also have trolls. And so I was talking to a guy and he does nothing but clean up social media sites and chase trolls. And he said, we've got people that are bored and they just go put crap in everywhere that has no value or substances. And so it's hard sometimes if you get in one of those situations, you're going to need some outside help because I sure in the world don't know how to handle it or how to get rid of them. Okay, Maria.
So Pat, we don't have any hands raised or any additional questions.
Okay. All right. I hope to see you all at our next session. We'll be sending that out. And then we have a COVID #2 coming up the first week of March. And we'll continue on that discussion as well. And so we'll be sending these out. So please remember your membership is helping to pay for these. And we value you guys as part of our administrative circle. Have a great rest of your afternoon. Have a good weekend.
Thank you, everyone.